Hi, my name is Lisa Warner. I'm here with my colleague Jane Livingston from the Department of Development at Cincinnati Children's. Thank you so much for inviting us to this morning's breakfast. It's truly an honor to be here and share more about our trans program. I'm sure most of you, when you think about Cincinnati Children's, you probably think of our Cancer and Blood Disease Institute or possibly our Heart Institute. But what you may not know and what has brought us here today is our trans program. Trans is a uniform term that refers to all identities within the gender spectrum. It can be gender nonconforming, transgender, or non-binary. An easy way to think about it is looking at our gingerbread person. This person represents the differences between gender and sexual identity. Gender, most people think they understand, but there's much more involved into it that we are trying to teach and educate people with. It's broken into categories, as you can see here. You have identity, orientation. Oh, I'm sorry. It's broken down into identity, orientation, sex, and expression. When you think about it, it's less this or that is what typically people think, and it's more a combination. It's this and that. The trans program was created in 2013 at Cincinnati Children's. It was founded by Dr. Leanne Connard. At the time, we had 100 patients. We offered one clinic per month, and we saw kids aging from 5 to 22. Today, we have over 700 patients. We offer 17 clinics per month, and the range of ages is 4 to 25. Just last month, we had over 100 immediate family members and patients come to our monthly support group. What we know and why we're here today. Trans youth have a higher rate of suicide, suicide attempts, homelessness, substance abuse, and discrimination. They have a higher rate of being victims of bullying and assault and suffer anxiety and depression. For kids, understanding and expressing their gender identity, it's confusing and scary. More importantly, gender variance is a normal part of development. It is not learned, it's not chosen, it's not due to emotional or mental disorders, and it's not determined by parenting. A few things that we hear from our patients and families is a child asking to be called by another gender, or they're drawing themselves as another gender. For the older patients, we'll receive calls from the parents that they think their child is going through a stage. In many of those cases, the child has just come out to their parents, and while it's a sense of relief for them, the parents do not know what to make of this. They don't know what to think, and they don't know who to turn to, so they call Cincinnati Children's. At that time, until the initial visit with the patient and family, we ask the parents and we give them access to our private Facebook page, which helps connect them with other families, and we invite them to the monthly support groups. One thing in particular about the monthly support groups is it's broken into tiers. They have categories where it's siblings. The parents can meet just within themselves, and the patients themselves, based on their age, they can address their issues. The support groups are all driven by the questions and areas that are brought up by the siblings, by the parents, and by the patients. As a nonprofit medical center, philanthropic support plays a vital role in our care and work. With your help, together we can expand our family support. Even with a wider acceptance and greater visibility in public, trans youth and their families face great challenges in navigating schools, care providers, workplaces, churches, and more. For these kids and families, having the ability to connect with other families facing similar challenges can be incredibly uplifting. With your help, we can provide more education and information. With the growing awareness of trans youth in the community, schools and care providers are often faced with issues they've never dealt with before. There's an increasing amount of demand for information and care for trans youth. More importantly, acceptance from schools and care providers is much needed. Being that trans youth in the care and information and education is a piece that's now more visible in the public, great strides have been made, but there's still a lot we don't understand about gender variant lives. To put it simply, we do need more research for the mental and the medicine health for these youth to provide and ensure improved lifelong outcomes for these kids. Thank you.